State officials in Massachusetts have issued warnings to residents in several towns due to an increased threat of Eastern Equine Encephalitis, or EEE virus, which is spread by mosquitoes. This advisory follows the classification of 10 communities in the state as high or critical risk for EEE. To reduce the mosquito population and limit the spread of the virus, aerial mosquito spraying will be conducted in Plymouth County, while ground spraying by trucks is planned for Worcester County, according to The Hill. The Massachusetts Department of Public Health announced that this is the first EEE outbreak in the state in 4 years. Department of Public Health Commissioner Robbie Goldstein highlighted the seriousness of the situation, stating, "We have not seen an outbreak of EE for 4 years in Massachusetts. This year's outbreak and activity raised the risk for communities in parts of the state. We need to use all our available tools to reduce risk and protect our communities. We are asking everyone to do their part." EE is a rare but dangerous virus, with a fatality rate of approximately 30% among those infected. Survivors often experience long-term neurological complications. The virus is transmitted to humans through the bite of an infected mosquito, typically during the summer and early fall when mosquito activity is at its peak. While EEE is most commonly found in eastern and Gulf Coast states, Massachusetts has seen periodic outbreaks, making it crucial for residents to remain cautious. In addition to spraying efforts, residents are being advised to take preventive measures to avoid mosquito bites. These include wearing long pants and sleeves when outdoors, using insect repellent containing DEET, and avoiding outdoor activities during peak mosquito hours, which are typically from dusk to dawn. In response to the elevated risk, town officials in Plymouth, Massachusetts have decided to close all public parks from dusk to dawn, as mentioned in a press release issued on Friday. These closures are intended to minimize residents' exposure to mosquitoes during the hours when they are most active. The state confirmed its first human case of EE on August 16th in Worcester County, underscoring the urgency of the situation. This case highlights the need for immediate action and vigilance by both residents and local authorities. In addition to public health measures, the state is also closely monitoring animal populations, as horses and other animals are susceptible to the virus. Veterinarians are advising horse owners to vaccinate their animals against EEE, as horses are particularly vulnerable and can experience severe symptoms similar to those seen in humans. The Centers for Disease Control and Prevention notes that the EEE virus circulates primarily between mosquitoes and birds in freshwater hardwood swamps, which are abundant in parts of Massachusetts. Humans and certain animals like horses can become infected when bitten by mosquitoes that have fed on infected birds. However, humans and horses are considered dead-end hosts, meaning they cannot spread the virus to other mosquitoes or people. With no vaccines or specific treatments available for EEE, prevention is critical. The incubation period for the virus ranges from 4 to 10 days, and symptoms can vary from mild flu-like symptoms to severe neurological conditions, including seizures, coma, and death. The CDC warns that even in non-fatal cases, the long-term effects of EEE can be devastating, leading to significant cognitive and physical impairments. As the state continues to battle the current outbreak, residents are urged to stay informed and take all necessary precautions to protect themselves and their families. State and local officials are working together to implement measures aimed at reducing the spread of the EEE virus, but community cooperation is essential in this effort.